Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Dr. Luper. How are you?
Hello, Haley. I'm doing great.
Good to hear. Well, one thing that we haven't really covered yet in our Sensible Health series is women's health. So I figured it might be time to touch on some of that. And I know you're not a woman, but you've been working with women for multiple years. So, and you have daughters. So can you kind of lead our conversation today? What I'm most specifically curious about is PMS and the symptoms and the side effects are associated with that.
So it's interesting you ask about PMS because the last patient I saw today is a PMS patient. And her complaint is that she has irregular periods and that she has severe PMS. She has a sleep disorder. She has cramping. She has mood problems. She has breast tenderness. She has the whole full meal deal in terms of symptoms on this, and she's had it for years. And the interesting thing is she's been to the doctor several times, and no one really has an idea about where this PMS comes from and what to do to fix it that she's talked to. Now, as so often the case, over the years, I've created a way of thinking about PMS that has been super helpful to treat it. And so let me just share my thoughts on this is. The thing we know about PMS is that hormones aren't quite right. Mm-hmm. Estrogen tends to run high.
Okay.
Now, if you run tests, estrogen goes high one day and low the next day, and it's hard to prove that there's an excess of estrogen that causes PMS. But the women who have higher have higher estrogen in average tend to have higher PMS symptoms. So there's some evidence. Let me just say there's some evidence around this. But the thing is, it's not really a hormone problem directly. Most women have PMS. Their hormones are fine. Not always. Some women have their hormones that are screwed up. But for how many women have PMS? And it's most women?
Mm-hmm.
So it depends on what research you look at. It's either a half of women or 3/4 of women, and I've seen as high as like 85% of women, depending on how you define PMS, have it.
Yeah.
It's mostly the severe ones that we really bring people into the doctor, and that tends to run around 20-25% of women have severe symptoms.
Mm-hmm.
So,
and the symptoms usually occur prior to menstruation.
Yes, so PMS, premenstrual syndrome. Mm-hmm. So what this is it's a collection of symptoms that fall together. You don't have to have every single one on the list, but women tend to have some of these on the list. And some of them are isolated, like breast tenderness. You can get breast tenderness and not have any PMS at all, but breast tenderness often goes along with PMS. And the whole kit and caboodle of these are associated with elevated estrogen. Now, the way I think about it is it's a digestive problem, fundamentally. Is that a surprise to you?
No, because you think everything is a digestive problem. But what I would ask is it more of like a liver problem?
Yeah, that's really what it is. It's a liver problem. It's not a digestive problem
And
directly.
Is it even a problem? Because so many people have this condition. So many women have this condition. So is it really a problem, or is it...
Yeah.
Okay.
It's an actual problem.
Well, I can speak from experience, and I can tell you that, yes, it is a problem every single month, but from, my life and living with it the last 25 years, it's been something I deal with haven't really until recently gotten, help for these side effects or symptoms, but it's just something that I've been taught to.
Yeah, most of the time, I don't know about you, but most of the time you take, 2 aspirin and try to get through the day.
Yeah.
It's not aspirin.
Get some
it's
ice cream.
Motrin
Yeah.
or Advil or something. You take something to basically kill the pain so that you can get through your day, or call in sick. That's the other thing that happens, is you just can't make it. You can't make it into work. And so my thoughts on this and how I treat it, and it's been, it's been reasonably successful. Very is probably a better word than reasonably, is one of the liver's jobs is to process old hormones, is to grab a hold of them, give them a good look. If they're funny and they're not quite right, to attach a little tag to them and then throw them into the bile for export to be taken out of the digestive system. And it's an important job, but it's not a life or death job. And so if the liver is on top of things and everything's flowing well, and then the liver just kind of stay on top of this job and get things to go through, and then you don't get any problem with PMS because the estrogen levels are regulated by the liver. They're not created, but they're looked over, and if they're old, they're removed from the body. Now, if the liver's busy from doing other things that are more important because they're more life and death dependent, like, for example, dealing with toxins that are coming in from the digestive system. Now, we've talked about this before a zillion times. Let me do it again. What happens is you have a weak digestive system that doesn't digest everything you eat. And they're leftovers that get to the lower intestine. And these leftovers feed the bacteria in the lower intestine. And the ones that like undigested food tend not to be our friends. Now, undigested fiber is fabulous because we can't digest fiber, and the organisms that live in us can, and so they digest fiber and they release short chain fatty acids. Our body soaks them up, we burn them for calories, they're healthy, they're useful, so it's a win-win. The bacteria come out ahead, we come out ahead, it's great. Now, if it's leftover pizza, we're not talking fiber here, we're talking meat bits, cheesy bits, oily bits, carb bits, whatever, these kinds of things. Then the organisms that live in us, they take what they want, of course, and because it's there, it's free food, right? And then they, poop out what they don't want. Except for it's not out. It is all in. And so that any stuff that they didn't want, well, it goes through our system, and our digestive system is very good about pulling things in, and so it absorbs a goodly amount of these, and they go over to the liver. Now the liver has to process whatever this thing in. Now it's microscopic poop mostly.
Yeah.
But it's toxic, so we call it toxins.
So that gets put on priority before all of the estrogen, producing estrogen. So if you're, coming up on your cycle, your body's producing more estrogen.
Yes.
Your body's going to prioritize the toxins.
Yes, because these things they run the risk of killing us. So they got to be dealt with.
Yes.
And this estrogen thing, man, we're not going to die. We just put it on the back burner and wait for another moment to do it because we're not doing it now. So the worse your digestive system is, the more the process of regulating your hormones is not done well. And then eventually the hormones pile up enough, and then the body says, we got to take care of this thing, so it batches them through. So it's hard to find the exact how high the hormones have to be a problem. It seems not to be how high the estrogen is more what the fluctuations are. So if the estrogen goes up and then plummets down, you'll get more PMS symptoms than if it's high. If it's high and fluctuates, the percentage is relatively low. Let me show you my hands. So here's a big tall pile of estrogen, and here's it fluctuating. So what's the percentage of fluctuation? Small.
Right.
Here's a low pile of estrogen, here's it fluctuating. What's the percentage of fluctuations? Huge. It's the same amount of fluctuation, but relative to how much there is,
this
has more variability than this has.
So the more variability there is in
Then the more
fluctuation,
symptoms.
the more symptoms. So if the body isn't processing it, if the liver isn't processing it, is that what creates the cramps? Is that what creates the insomnia?
Yes. 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 And here's the other thing. You think, well, what's so special about, women who are childbearing age? What about other women? Don't they get this? And the answer is yes, they do. Except for we changed the name.
Yeah.
We call it menopause symptoms, right?
Okay.
People who have a hard time with menopause, same story.
So do they, okay.
Same
okay.
story. Seriously, you get symptoms, and it's caused by the same kind of thing. In this case, it's not only put premenstrually, where you're most sensitive to it. It can run throughout your life, because you don't have a menstrual cycle
So
anymore.
you don't have, yeah, exactly. You
or
don't
you're
have that
perimenopausal, and it's
hormonal
irregular,
cycle.
and you're getting all these symptoms associated with it. Now you're at a different phase of life. People are different. The symptoms will manifest slightly different, but the story is the same. The treatment is the same. And also,
treatment for the same.
PMS and
PMS?
treatment for menopause are not identical, but they're very similar to
Okay.
each other. Very similar to each other. There's a lot of overlap between those. Also, nausea of pregnancy. That's another one. It's same story. You know how interesting, isn't it?
It's from hormonal
Yeah.
production.
Right,
Oh,
right.
I didn't know.
And you get right, and it's the same kind of treatments for all the same. For example, B vitamins tend to be helpful. B6 in particular. Now we know B6 is helpful with the nausea of pregnancy. It's one of the main things that you do. I mean, if you're just going to go try something, go to the grocery store and get something to do. Mostly it's B6. That's what most doctors will start with. Is that same with PMS, same with menopause. Now it's not particularly effective by itself. Because they're not really addressing the toxins coming in from the digestive system. All it's doing is it's giving the liver a little boost and helping it do its job better. Because B6 is important for what the liver does. And sometimes that's all you need is a little boost and it'll take you out of it. Most of the time it is just inadequate. And you do not get better from doing vitamin B6 by itself. You need to really go through, find the infections, figure out what to do to take to get rid of the infections. Antibiotics don't work. I'll tell you again, antibiotics don't work. Now they do work. They work beautifully.
But they'll clear you out. They'll
Yeah, and
clear
then
out
then
the
all
good
the
stuff,
same
too.
crap grows back that it did before. The
Yeah.
problem isn't the bacteria. The problem is the environment that the bacteria grow in. So the problem is the undigested food leftovers. That's the problem. Now the problem too is that if you change your diet and you have no leftovers anymore, now you have a bunch of mad bacteria that are angry and hungry and sending you signals to go get pizza. Pizza, right? And you go into zombie mode and you start, eating things you shouldn't eat.
Ice cream out of the freezer.
That's one of the things that's funny about PMS is there's a lot of food cravings that go along with it.
Big time.
Yeah, and one of the things we don't want to skip on this PMS thing is if your mood is already testy from whatever reason, then this just makes it that much worse.
Oh yeah, amplifies it. Pours gasoline on the fire.
Very much so. So serotonin levels have a lot to do with how intense the symptoms of PMS are.
Okay.
So the symptoms are being driven by the hormones and by the digestive system. But whether you can just kind of shrug it off and get through the day, or whether you're crushed and destroyed, depends on what your serotonin levels are.
And what your serotonin levels are depend on what your gut is producing.
Well, there's that too.
Always full
Round and
circle.
round and round
Always
and it
full
goes.
circle.
So Haley, we do the same show every week.
Yep.
We change the words, but it turns out to be
All connected to the gut. It's kind of crazy.
And it really is. It's not like I have some kind of theory that this is
No.
how it is. No, this is how it is.
Yeah.
And it's nice for me because when somebody comes in, like our last patient we just saw, she comes in and she's been suffering for years.
Yeah.
And I go, sweet, I know how to fix this. I mean, I don't necessarily say that out loud because, who knows, right? She could be the weird one that didn't get it to work. I can't make promises. But in my mind, I feel extremely confident to be able to help her. So what we're going to do with her, we're going to run some tests. We're going to find out what's growing inside her. That way we'll be able to target some sort of treatment to clear up the infection, and to repopulate it with healthy bacteria. And we're going to get some more fiber in her diet to build up the beneficial bacteria. And there's a bunch of stuff we're going to get the ball rolling as we go through this process. And I'm very, 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 very confident that we're going to be able to help her because I've done so many times. I mean, it's confidence built on experience.
Right. So how long does it usually take you to, help the liver start processing all of the hormones?
That happens very quickly.
That one happens quickly. What about the gut infection?
Then we can clear that one up fairly quickly too. So that usually we can get the liver working well within a couple of weeks. We can get the infection mostly better within a couple, 2-3 weeks. To actually get the PMS to settle, though, it's weird. It's longer than everything else. The last thing to get better will be the actual PMS.
Really?
And it turns out to be
mood or
3 months.
Okay.
Why? Why is it so slow? I don't know. It just is. It's about a 3-month process.
Is it like there are so many different aspects to PMS as a whole? Is it the mood? Is it the cramping? Is it the insomnia or all of it?
Yes, all of it.
Okay.
Yeah, all of it. It tends to be the first one, for whatever reason, continues on, and then the second one is better, and then the third one basically is great.
Okay.
So that's usually how it goes. That's the pattern. I don't know why it takes so long. I wish it didn't take so long, but it is what it is. So it goes like that. So I want to talk more about treatment, and I got some notes here to make sure I didn't forget anything. Actually, before I do treatment, there is something I forgot. It's to do hormone testing. Mm-hmm. Now, I don't always do hormone testing with PMS, but every once in a while, it's not just that the liver is not processing normal hormones well, it's that the hormones are actually not being produced correctly. Okay. And mostly the pattern I see is that the progesterone tends to run low and the estrogen tends to run high, and it creates an imbalance. And so there's a couple ways to fix this. One is you take progesterone. So if the estrogen is high and the progesterone is low, you take progesterone and now they're equal.
Yeah.
Mm-hmm. Another way to do it is lower the estrogen and now they're equal.
Mm-hmm.
And then it works better that way. Not to say that one way or the other way is better. I mean, it's just that you can solve the problem that way. Now
they need to be equal amounts, though.
But not by blood level.
Yeah.
But by the test level.
Okay.
The test has low and it has high.
Sure.
And so it gives you a indication in it.
Yeah.
And then the estrogens are low and high. Now the numbers are all different, but we get a sense of, they could be low together and they could be high together and they could be in the middle together, but if they're separated, now you got a problem. And we're separated this way, now you got a problem as well. So the thing about getting estrogen levels into balance with progesterone is it's easier to take the low one and then take something that gets it to go up than it is to take the high one
and take something
and get it to go down. So how would we get it to go down? We would get the liver working better.
Yep.
And it would clear the hormone out of the body better.
Mm-hmm.
And now we're caught up.
So we'd be, recommending supplements to increase liver function?
Bile flow. Bile flow. So bile is made by the liver.
Uh-huh.
It has several functions in the body, but the one we're talking about is it's a carrier for junk that we want to get rid of.
Okay.
Like old hormones.
So bile flow, is that like a name brand supplement that you recommend, or is
No.
that just okay?
The flow of bile.
Yes, yeah.
The way I think of it is the liver cells are set up in these tubes, and they're all lined up in these little round tubes. In the center of the tube is a bile duct. Mm-hmm. And so the liver does the cells do whatever they're going to do, and then they got this thing, they want to get rid of it, they pitch it in the bile duct. Literally, they go into the bile duct, and then it floats on down the stream. Bye. There it goes. Except for no, it's not going.
Yeah. So
the liver got swollen.
What do you do?
There was the backup somewhere in the line, and now it just sits there and doesn't flow correctly. And now, oh geez, it's stinking over here. The sewage quit flowing.
Yeah. So what do you do to help support the liver in those ways? Reduce inflammation and.
Okay, we've been working together for a while now.
I mean, I know. I'm just asking you for the show's sake.
You tell me.
Conversation.
How do you get the bile to flow?
Well, you reduce inflammation.
That's right. Get the liver to shrink.
Yes.
So there's the herbs we can use and stuff. Take some liver herbs, right?
You said B6 was good.
The big one.
The big one.
You know this one.
Is it castor oil
Yes,
pack?
it is.
Yeah.
Bam! Woo-hoo!
Okay. So we can do a castor oil pack.
Castor oil pack.
Yes.
We've talked about these before. Just so people who don't know, you take some castor oil, you put it on a piece of flannel, and you put the piece of flannel over your liver. The liver's on your right side. And you just leave it there. Now, it's nice to cover it with a piece of saran wrap and maybe a towel, so that it stays warm. Your body heat can heat it up, and it literally soaks through your skin and stimulates your liver. Now,
how long do you leave it on?
about 45 minutes.
Can
you
you
can do
leave
it
it on
longer or
overnight?
shorter. You can leave it on overnight. I just don't like stimulating things that long.
Okay.
People tend to start getting reactions.
Sure.
It overstimulates things. And so I'd rather pulse it and then take it off, and the next night do it again, and the next night do it again.
Okay.
And castor oil is extremely stimulating to smooth muscle. Now, if you drink it, it'll blow you up.
Yeah,
it'll give
you're
you the worst diarrhea you ever had in your entire life.
out very quickly with
your
that.
smooth muscle will be extremely activated, which is too much. Now, if you let it go in through the skin, only a little bit gets absorbed. It's a nice, gentle effect, and so that gets the flow going in a gentle way without blowing you up. Honestly, the best way to do this thing, it's a hassle, so I don't really recommend it very often, but it is in fact, best way to get bile flow is a coffee enema.
Okay.
You take coffee, you brew it up, you let it cool down, you put it in an enema tube, and you do a rectal enema, and you put the coffee into you, and then hold it there for about 20 minutes.
What about a coffee enema stimulates bile flow?
What about it?
Yeah.
I don't know.
Is
I
it
think
the caffeine?
The caffeine's part of it. I also think it's the tannins from the coffee. So, yeah, and it works. I mean, it really works. Now, you don't hear me tell people to do coffee enemas hardly ever. I'm aware of it, but it's like, I mean, coffee enemas like, well, you got to be into this thing. Or you do a castor oil pack, which is easy. You sit and watch TV or read a book and just relax, and it's much more comfortable to be able to do it. There's less fuss that goes into it, and for most people it's better. Most women it's better. If I get really somebody is I really need to do this, it's super important. Their life's on their line. They got some kind of inflammation or something going on, and we just got to get the bile out of them. Bingo, coffee enemas. That's the best way. Okay, so I'm not recommending coffee enemas to treat PMS. It's overkill. There's better ways to do this. So let me talk about some of the other things that are helpful. Magnesium is helpful. Magnesium tends to...
like the natural magnesium,
Yeah, exactly.
the drinkable.
Yeah, it's a cofactor in a lot of the jobs that the liver does. And so...
As a nightly supplement, or just like during your menstruation, or...
Yes, as a nightly supplement and extra.
Okay.
During your menstruation.
Okay.
One of the things that magnesium does is it relaxes smooth muscle. In fact, I have to be a cautionary. The castor oil tends to stimulate smooth muscle. So if you're in the middle of horrible cramps, castor oil is not the best thing to do. Now, it's great to prevent them.
Okay.
But when you're in the middle of them, stay away from it. Whereas magnesium is super good to treat cramps. So if you can actually soak up magnesium in your body, then your chance of getting cramps goes down, or the intensity of the cramps that you do have go down. And so one of the best ways to treat super bad cramps is to throw a couple of cups of Epsom salts into a warm bath, and then get into the bath and just soak it up. The water is helpful. It's a miracle cure, honestly, is what it is.
Yeah.
It really is.
It's
amazing. It's extremely effective. The problem is you can't stay in that tub for the rest of your life. At some point, you're going to have to come out.
Yeah, there's unfortunately a time limit before you turn into a raisin.
That's right. A salty raisin, because you got the salt.
Yes.
All right, so there's a bunch of herbs that are super helpful with this. And what the herbs do, by and large, is they help the liver do their job better, do its job better. I say they because there's a bunch of cells, right? But anyways, Let me just give you a list of these herbs. The one that these are like my favorites. There's a bunch more too. Vitex, otherwise known as chasteberry, is super good. It's a hormone balancer. Just tends to work real well. Symptoms can tend to come down. I think the name chasteberry is interesting. Chaste means that you forbear sexual relations. If you nuns are chaste,
it is.
right?
That is interesting. Okay.
So you're not so hormony, right? You're like, I'm good.
No, I'm good. That's funny.
Okay, there it is.
Okay.
Cimicifuga is another famous one. It's black cohosh. Ginkgo is another good one. Ginkgo helps with microcirculation, and so the blood vessels around the liver cells tend to work better.
What's ginkgo's Latin?
Ginkgo biloba is actually the Latin name. I think it's ginkgo is what it is.
Okay.
So, yeah, I think ginkgo is called ginkgo. It's one of those weird ones.
Okay.
And hypericum is another herb. And hypericum is different. It is stimulatory to the digestive system, so the digestive system tends to work better. But I think the real thing that hypericum does is it helps with serotonin regulation. It helps to increase serotonin levels in the brain. Kind of acts as a natural serotonin, a select serotonin reuptake inhibitor, an SSRI. It's a natural SSRI is really what it is. So you have to be careful about hypericum, because if you are on an SSRI and you do hypericum along with it, and you do high doses of it, you can get too much serotonin in your brain, and instead of making you calm and relaxed, you get exactly the opposite effect. You get jacked up, and you get nervous, and you get depressed, and you get just, the crazy just goes way more. So hypericum is very helpful. You just got to be careful. With strong things comes potential for side effects. Hypericum is one of those. Additional one that's helpful is glycyrrhiza. It's a licorice root, and that helps with hormone production in general, hormone balancing, helps the adrenal glands work particularly well. It's anti-inflammatory. It's also an antiviral. It's got all kinds of other side effects that it has, or other effects rather than side effects that it has. And basically, it's just one of those things that usually mix in to a formula with these other herbs. And the last one's Angelica, otherwise known as Dongquai. It's a Chinese herb, and it works really well to help balance hormones. I use it a lot of times with the Cimicifuga and the Vitex. So those three together, if we're going to use one, I mostly use the other two as well, because they work together well. They complement each other. 1 + 1 doesn't equal 2. 1 + 1 equals 3.
Yeah.
In this case, 1 + 1 + 1 equals 7.
You're just giving us the whole the hormone balancing tincture recipe here.
That's what it is, right? This is what we use. That's where I got this list, is from the concoction that we use. A couple other things. Fibrocystic breasts are related to breast tenderness. They're not exactly breast tenderness, but fibrocystic breasts are what's happened to breasts when there's a lot of inflammation, and they get extra connective tissue laid into them, and they get lumpy and bumpy and painful.
Yeah. They, can be painful. They can be pea-sized. They can be a little bit larger, a little bit smaller, and they could be like misshaped, and then you're freaking out thinking you have a lump at 27, but really it's hormonal.
Yes. So this is one of those symptoms of this whole PMS collection. Breast tenderness is an aspect of it. The fibrocystic breast is a further aspect of it. Over time, one can turn into the other, for example.
Right.
Or you can have a fibroid, which is not cancer, but you get an increase in the lining of the endometrium. And
Wonderful. Well, I think that's all we have time for today, Dr. Luper.
Okay.
I apologize. Thank you so much.
Thanks.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.